You may not have risk factors for blood clots, but you can still develop them. That is why it's important to know the warning signs. This video on Pars Health TV will show you the 8 signs of a blood clot that can't be ignored. Blood clots affect everyone differently, but there are usually clear symptoms. What is a blood clot? A blood clot is partially clotted blood in a blood vessel. Blood vessels are your body's highway system. They provide a path for blood to flow from the heart to other body parts. There are 3 types of blood vessels. Arteries, they carry blood away from the heart. Veins, they carry blood back to the heart. Capillaries, they connect arteries and veins. Blood clots can form anywhere within 60,000 miles of your body's blood vessels but are most likely to form in the veins, venous blood clots. Number 8. Racing heart. When oxygen levels are low, the heart rate increases to compensate. Dr. Teitelbaum says that a lumpy feeling in your chest and difficulty breathing deeply can be your body's SOS signal that PE is lurking in your lungs. With small blood clots, part of the increase in heart rate is due to the chest pain, shortness of breath, and associated anxiety they cause, says Lewis Nelson, MD, chairman of the Department of Emergency Medicine at Rutgers Medical School of New Jersey. Lung tissue also releases chemicals that cause the heart rate to increase. If the clot is larger, it leads to lower blood oxygen levels and even changes in blood flow that can cause a compensatory increase in heart rate, said Dr. Nelson. Number 7. Feeling faint. Dizziness is caused in part by chemicals released from the lungs, blood oxygen saturation, and changes in blood pressure and heart rate, said Dr. Nelson. The brain is very sensitive to changes in oxygen levels and changes in blood flow. Although this is not a very common symptom of a blood clot, it does happen enough times. A study published in the New England Journal of Medicine found that pulmonary embolism was the cause of about 17% of fainting hospitalizations among 560 older adults. Number 6. Chest pain. Chest pain can suggest a heart attack but can also be a pulmonary embolism. Both PE and heart attack have similar symptoms, said Dr. Navarro. However, PE pain is often sharp and stabbing and feels worst when you want to take a deep breath. Pain from a heart attack usually radiates from the upper body, such as the shoulders, jaw, or neck. The biggest clue is your breathing. PE pain will gradually worsen with each breath. In any case, if you need immediate help, call 911. Don't forget to subscribe to our channel and hit the notification bell to get more informative videos. Number 5. Shortness of breath. Blood clots in the lungs can slow down the flow of oxygen, which can cause shortness of breath. You usually don't have enough strength or breath to climb the stairs. You feel bad, says George P. Teitelbaum, MD, interventional neuroradiologist and director of the Stroke and Aneurysm Center at Providence St. John's Health Center in Santa Monica, California. Get help quickly, especially if it happens suddenly. New shortness of breath that is different from what you experienced before may be a sign of blood clots in the lungs, especially if the feeling persists. If you have a blood clot, you may experience shortness of breath with light exercise for hours or even days, notes Dr. Trans. If you're out of breath for a second and then everything's fine, it's probably not good. Number 4. Unexplained cough. Can't stop hacking? If you also have shortness of breath, a fast pulse, or chest pain, it could be PE. The cough can be dry, but sometimes people cough up mucus and/or blood, says Dr. Navarro. If you are in doubt, talk to your doctor or the emergency room. Another sign of a blood clot in the lungs is coughing up blood. Mucus, spit or phlegm, contains more than a little blood. It's more than a teaspoon or a tablespoon of blood, says Dr. Trans. Number 3. Swelling in one limb. Swelling of the legs or arms is one of the most common symptoms of DVT. Blood clots can block healthy blood flow to the leg, and blood can pool behind the clot, causing swelling, says Dr. Navarro. If you have persistently thick or stiff legs while flying or stationary, it is normal to ignore leg swelling as a symptom of DVT. But be careful if your swollen limb appears quickly, especially if it hurts on one side. Most people usually have some degree of swelling in their feet, especially at the end of the day. It's not the swelling we're worried about, said Dr. Cod Liver Oil. Instead, watch for swelling. Happens suddenly or more dramatically than usual. Lingers throughout the day. Doesn't get better with leg elevation. Number 2. Leg or arm pain. Often DVT pain occurs along with other symptoms, such as swelling or redness, but sometimes it can occur alone. Unfortunately, pain caused by a blood clot can easily be mistaken for a muscle spasm or strain, so this problem is often underdiagnosed and especially dangerous, said Dr. Navarro. DVT pain tends to occur when walking or bending the foot up. If you have a Charlie horse that you can't seem to shake, especially if the skin around it is warm or discolored, ask your doctor to take a look. New leg pain, such as calf cramps or Charlie horse pain, may indicate a blood clot in the leg. But if the pain only lasts a few seconds and doesn't come back, it's probably not a blood clot. Thrombosis symptoms don't come and go quickly, says Dr. Trans. They stay. Number 1. Redness on your skin. Even if the bruise is actually a blood clot, you don't need to worry about it. You cannot see DVT. You may see discoloration that looks like a bruise, but you'll likely see red. DVT can cause redness in the affected limb and make your arm or leg feel warm to the touch. Prevention tips. You can take steps to decrease your chances of blood clots. First, maintain a healthy weight, eat right, and exercise. Also, do not sit or remain still for a long time, especially after a long trip or surgery. If you're a desk jockey, get up and move around at least every few hours. Bend your legs, feet, and toes in a chair. See if tight compression socks or clothing can help your circulation. Ask your doctor if you need to take anti-clotting medicines called anticoagulants. Do you have any of these symptoms? Don't hesitate to leave a comment and share your ideas with us. And please share our videos with your friends to support our team. Don't forget to watch more of our videos on the left and right of your screen. Thank you, guys, for watching.